After lots of back and forth, Congresswoman Marcy Kaptur did vote for the bill. Meanwhile, Bob Latta cast his long-expected no vote. Kaptur says coverage will be better for everyone, while Latta says Democrats need to watch out.
What's going to happen is that an insurance exchange will be established of all private plans. So all this talk about, oh, it's a government takeover, those are false statements because there is no public option. There is no government plan. It's merely allowing people in our country to look at a menu of insurance offerings.
I think the American people have to make some decisions out there. You know, did they get what they wanted in 2006 and 2008? Is this the direction of the country that they want to go? Are they better off today than they were, you know, at the beginning of 2009? And I think a lot of people are going to say, no, we're not.
The campaign's begun already. Latta does have some questions about what the Senate will do with some of the changes they made by the House. And speaking of the Senate,
it ignores the fact that Medicare is going to run out of money in 2017. In other words, the money coming in isn't going to be adequate for the people they're taking it out. And what they're doing is they're taking over $500 billion out of Medicare to expand this program, which means that many of the people that are on managed care are going to end up getting less money than what they should be getting.
Senator George Voinovich giving his opinion on the health care legislation. He says there are some things he does support in the bill, but it bothers him that it's going to contribute to our debt situation. Senator Voinovich wasn't just talking health care in Perrysburg this afternoon. He was speaking at the Holiday Inn French Quarter in Perrysburg about how to create a healthy business climate, economic growth, and jobs. He also accepted a Lifetime Achievement Award from the Northwest Ohio Development Association for his work. Well, this health care overhaul will affect the majority of Americans, even doctors. But there are still so many unanswered questions about what exactly will happen because these changes are not going to happen overnight. Allison Brown is in the newsroom with one doctor's perspective on this reform.
Dr. Jeffrey Gold at UTMC says it's time to talk about the future. Big changes in health care won't happen for a few years, but we have to plan now.
This is a remarkable time in the history of our country.
The goal is for everyone to have health coverage in the country, but it's going to take a few years.
Well, I think early on it's just going to cause people to start to ask some questions as to how satisfied they are with their health care and what other opportunities that might arise for them in the future. I think there's going to be almost no immediate ramifications of this.
But in the next months or years, factors like your age and income could determine how the health care overhaul affects you financially. Dr. Jeffrey Gold at UTMC says hospitals could have some trouble if they're not prepared for at least 32 million people to get care when they need it.
We're going to have a pretty big mismatch between the demands on the American healthcare system and the physician and other healthcare provider workforce.
Dr. Gold says that means growing the role of the primary care specialist.
One of the greatest hopes of the healthcare reform is by providing health insurance to another 33 million people is to keep them out of emergency departments and out of hospitals.
Now, Dr. Gold says places like UTMC have been prepping students in the classroom for the changes to come. Hopefully it will make the transition more effective. Reporting live, Allison Brown, Fox Toledo News.
So what do Toledoans think about health care legislation? We asked area residents their thoughts on the bill this afternoon.
I think it'll lower my health care costs, frankly. I think it'll make things much fairer. I think it'll help put the United States par with the rest of the world.
I've been self-employed quite a bit in my life, and it's been very difficult to get health insurance because of some previous conditions, and I've had to pay very high premiums because of that. So I don't know specifically what this would do, but I think it would help people that have been in that